Senator from Arizona.
Mr. President, I regret that the senator from Illinois did not observe the courtesies of the Senate, particularly when a person's name is mentioned, as he continued to mention my name throughout, and totally falsifying my position both in the presidential campaign and the position that we have on this side and this amendment. I've always extended the courtesy to the senator from Illinois, and I deeply regret that even this comedy of the Senate is no longer observed. So I say to the senator from Illinois, I regret that you would not respond to a question that I had posed, and you had said, I will respond in a minute. So again,
Senator,
even a comedy is not observed
Senator,
here.
if the senator would yield for a second.
I will go ahead with
Would the senator yield for a second?
The senator did not provide me with the courtesy of allowing me to respond to a question. Now you want me to respond to a question from you? I will display a more courtesy than you displayed to me. Go ahead.
I apologize. I planned on yielding to you. I'd be happy to yield to you. I always do, and I failed to. I apologize.
Well, the senator, I guess my questions were, one, did the senator who claimed that we have no Republican has done anything to curb the health care insurance industry, was the senator in the Senate when Senator Kennedy and I fought for weeks and months for the Patient's Bill of Rights? Was the senator here then? Was he engaged in that debate? Senator Kennedy and I fought for the Patient's Bill of Rights, and a majority on that side of the aisle opposed it. So the fact is that there have been efforts on my part to curb the abuses of the health insurance industry by sponsorship of the Patient's Bill of Rights. Second of all, during the campaign, yes, I said that we could reduce and eliminate waste, fraud, and spending in the fraud, abuse, and waste in spending. And I said it because of Senator Coburn's Patient's Choice Act, which could save $1 trillion from the states in Medicaid savings, $400 billion over the next 10 years in Medicare savings. I wish that the senator from Illinois would examine the Patient's Choice Act as proposed by the senator from Oklahoma. Maybe we would learn something. The senator from Oklahoma's bill wants to preserve the best quality health care in America and not eliminate $120 billion to the Medicare Advantage program, which 330,000 of my citizens are enrollees in and like and want to keep. $150 billion to providers, including hospitals, hospice, and nursing homes. $23 billion in unspecified decreases to be determined by a, quote, independent Medicare advisory board, as well as billions of additional cuts to the Medicare program. There is no relation between what I tried to do in my campaign and what is being done in this legislation. I tell my friend from Illinois. I'll be glad to hear the senator from Illinois' response. I'd be glad to extend him that courtesy.
I thank the senator from Arizona, and I commend him for his work on the Patient Bills of Rights, which I joined him in with Senator Kennedy and would do it again. The point I was making during
was that no Republican had done anything. You just said no Republican had done anything to curb the health insurance industry. The Patient's Bill of Rights certainly would have done that.
My point was that there are provisions in this bill dealing with the rights of consumers against health insurance companies, which I have not heard the senator or others.
That's not what you said.
Well, I would just ask you, do you support the health insurance reforms in this bill that give patients the right against health insurance companies on pre-existing conditions, for example?
My record is very clear of advocating for patients and against the abuses of insurance companies across the board.
We thank you for that.
So, Mr. President, I ask unanimous consent to yield to the senator from Oklahoma to describe the Patient's Choice Act and the way we could truly save money and reduce fraud, abuse, and waste in the system, and at the same time preserve quality health care.
Mr. President, thank you. There needs to be some clarification. Medicare doesn't cover everything. 84% of all Medicare patients have to buy a supplemental policy now. You know what Medicare Advantage is about? Who set the prices on Medicare Advantage? The government set the prices on Medicare Advantage. The very same people that you want to run it now created a 14% premium. The insurance industry didn't set the prices. The Center for Medicaid and Medicare Services set the prices. The government is responsible for that differential. Now, why is Medicare Advantage important? Because the vast majority of the people in my state and every state who have Medicare Advantage can't afford to buy a supplemental policy to make them whole on Medicare because Medicare won't cover it. So Medicare Advantage for 89,000 Oklahomans is the only way they get equality with the rest of their peer group that can afford to buy a supplemental policy. And now we're going to take that ability away from the poor seniors in Oklahoma, Arizona, Iowa, Illinois, and we're going to say, you don't get what everybody else because you are economically disadvantaged, so we're going to give you substandard care and we're going to take more of your income. Medicare Advantages offer the things that you get with a supplemental policy when you can't afford to buy a supplemental policy. So the very idea to say we're going to take that away, when you're taking that away from the cheapest program that we really have in terms of performance. Because what Medicare Advantage does, which their bill and this bill purports to do, is recommends and encourages and incentivizes prevention, like the senator from Iowa wants to do for everybody. It incentivizes. It doesn't cost to have a prevention exam under Medicare Advantage. It doesn't cost. There's no out-of-pocket cost for our seniors that are poorer who happen to have the benefit of Medicare Advantage. You're going to take that away. You're going to destroy it for 11 million seniors. The ability to get a pre-clearance, a screening exam, without them having to spend money on it. Now, is there a way to get money out of Medicare? Yeah. There's $100 billion worth of fraud a year in it. And according to Harvard, there's $150 billion worth a year of fraud in Medicare. There's $2 billion worth of fraud. Now, I want to address something else that the senator from...
Before the senator continues,
I'd be happy to...
Let me... I ask unanimous consent to regain the floor and then be able...
Without objection.
Engage a colloquy with... I ask unanimous consent to engage in colloquy with the senator from Oklahoma.
Is there objection?
Mr. President...
Without objection.
Mr. President, I have to address the situation since I have been accused by the majority leader of changing my position. In 2005, the Senate considered the Deficit Reduction Act of 2005, which called for approximately $10 billion in reduction in Medicare costs, approximately $10 billion. Senator Harry Reid, Democrat, Nevada, said, quote, "Unfortunately, the Republican budget is an immoral document. Let's look at what is in the bill before us. The budget increases burdens on America's seniors by increasing Medicare premiums, and we have not seen what the House is going to give us. It cuts health care, both Medicare and Medicaid, by a total of $27 billion. The majority leader was outraged in 2005 that there should be reductions in Medicare and Medicaid spending of $27 billion. Now the distinguished majority leader, with the white smoke coming out of his office, now says that he's for $483 billion in cuts in Medicare. That, my friends, is a remarkable flip-flop. And by the way, I might add that Senator Dodd, who's here on the floor, said concerning this reduction, this Deficit Reduction Act of 2005, Senator Dodd said, for example, this bill cuts funding from Medicare and Medicaid, which provide health care to poor children, working men and women, the disabled and the elderly. Now, what a plea. What a plea. Senator Barbara Boxer said, Mr. President, I strongly oppose the reconciliation bill before the Senate. The bill would cut vital programs for the middle class, elderly, and poor. That's why I cannot believe only 2 months after Katrina, we have a bill that would cut Medicare and Medicaid by $27 billion. And the list goes on and on. And now before us, we have cuts of $483 billion, including hospice, including hospitals, including other vital programs for our seniors. So if we're going to go around and talk about flip-flops, let's look at the rhetoric that accompanied my colleagues on the other side in their opposition to $27 billion in savings, which, by the way, actually only saved $2 to $3 billion over 5 years. So I would ask my friend from Oklahoma, does he believe that it is possible to make these cuts, including from the Medicare Advantage program, and establish a Medicare commission that would not, over time, cut benefits that exist today for Medicare and Medicaid patients?
Mr. President, I would answer my colleague by saying this bill is a government-centered approach, not a patient-centered approach. It's the very reason that we're in the trouble that we're in today, is that we've had the government making the decisions rather than the patients and the physicians, and will, in fact, lessen the care for seniors. I gave a speech earlier this morning on the floor that if you're a senior, you should be worried, because the Medicare Advisory Commission and the Cost Comparative Effectiveness Commission will now decide ultimately what you got. And we have an amendment on the floor, which in many ways I support, I would like to modify, about reinstituting what should be the standard for mammography for women. How did we get there? We have a commission that looks at costs and not patients. From a cost standpoint, the task force on screening is absolutely right. But from patient standpoint, it's absolutely wrong. How do we decide the difference? Do we make the difference based on what something costs, or do we make it on what my wife, who will soon be a Medicare patient, receives? So the question is, will the cuts that are manifested by this bill impact seniors' care? And as somebody who's practiced medicine for 25 years and cared for seniors for longer than that, I will tell you undoubtedly, they will have delay, they will have denied care, and 80% of them will be just fine. But 20% of the seniors in this country will be markedly hurt by this bill, because a bureaucracy looking at numbers, not patients, never putting their hand on a patient, will make a decision about what is good for them and what is not. And everything we know about medicine is that's exactly the wrong way to practice it, because every patient is different. Every patient's family history is different. And so when we talk about taking $120 billion out of the Medicare Advantage program, what you're talking about is decreasing access to some of the most important screening capabilities that many of these people have, and making them unaffordable because they can't afford a supplemental Medicare policy. They can't accomplish it. Now, I want to address one other question. The majority whip said the Republicans haven't had a bill. During the markup in the Health Committee, I went through point by point on the Patient's Choice Act. The Patient's Choice Act puts patients and doctors in charge, not government in charge. The Patient's Choice Act neutralizes the tax effect to make everybody treated the same in this country as far as the IRS is. Right now, if you get insurance through your insurance company, you get $2,700 worth of tax benefit. If you don't, you get $100. That's really fair. That's one of the reasons that people who don't get insurance through their employer can't afford health insurance, is because we don't give them the same tax benefit. It would give a tax cut to 95% of Americans, plus help them buy their care. The Patient's Choice Act solves the liability problem by incentivizing states to have reform in terms of the tort problem that we have, that we know costs at least 6 to 7% more than we spend on health care than we would if we had a realistic tort system. Finally, we go after insurance companies because we do what's called risk readjustment. If you're dumping patients or cherry picking, guess what? You get to pay. You have to pay extra. You have to pay to the very insurance companies that are covering those sick people. So we changed the incentive to where an insurance company is incentivized to care for somebody rather than to dump them. I was an advocate when I was in the House of the Patient Bill of Rights. I was defeated at every turn trying to make this. And to say we didn't come with a bill when on a party line vote in the Health Committee, 13 voted against a common sense bill that didn't increase taxes, didn't increase premiums, covered more people than this bill will cover by 4 million, put everybody in Medicaid in a private insurance policy so no longer are they discriminated against the doctors who won't take Medicaid, taking the Medicaid stamp off their forehead, and giving them the same access to health care we have.
So does my colleague find it entertaining that my friends and colleagues on the other side of the aisle, who in 2005, as part of the Deficit Reduction Act, we had to bring in the vice president who I think was overseas in order to break the tie because they were worried about what Senator Reid called immoral, the Republican budget, an immoral document. And by the way, is the senator aware that the Citizens Against Government Waste have come out in favor of this amendment? Mr. President, I ask unanimous consent that a letter from the Citizens Against Government Waste be included in the record.
Without objection.
And also, as you know, many of the seniors in my state, I would ask my colleague, have been very puzzled at the AARP's endorsement of a proposal that would cut their Medicare, that it's already been made clear that Medicare Advantage, and there's 330,000 of them, senior citizens in my state that are under Medicare Advantage, that it's been announced that it'll be slashed, that somehow the AARP is now supporting. All I can say is my friend aware that there's an organization called 60 Plus, an organization called 60 Plus that is working very hard on behalf of seniors to make sure that they don't lose these benefits?
I am, and I would tell the senator again, how are we where we are? How are we where we are when we're going to take programs that are working? Granted, I think Medicare